talk frequently about nurses who work stress or nurses who are burned out, but we haven't spent a great deal of time talking about what got them to that point. And cognitive overload is one of the fundamental causes of burnout, stress, and depression. Cognitive load is comprised of the 8 core cognitive capabilities that all of us have. It's when those capabilities are stressed beyond the individual's ability to manage those that it becomes overload. Those 8 core capabilities are the ability to sustain attention, a response inhibition, how quickly an individual can process information, flexibility and control of the cognitive senses, multiple simultaneous attention distractors, working memory, how folks categorize information, how someone can take information and determine if it's important or urgent, and then recognizing patterns of information. All of those are cognitive capabilities. Nurses in particular go through exercising one of those 8 capabilities hundreds, if not thousands of times per day. Because they cannot control how information comes to them, they cannot control the method that it comes to them, or they cannot control the volume that comes to them. So in recognizing cognitive burden in clinicians, it's frequently errors of omission or commission, nurses who are not coping well with the environment around them, nurses who become forgetful, appear stressed, and over time it can lead to burnout. One of the most severe responses to cognitive overload, and then eventually even depression. So there are a few important ways to manage cognitive burden for the clinicians, because as you know, every day nurses have to go through the process of categorizing information, determining if it's urgent or if it's important, slotting into the perfect workflow, if you will, for each patient. And they'll go through this iteration hundreds of times a day for every patient. So some really helpful ways to help manage that is ensure that information that goes directly to the nurse that at the point of care is information that can be acted on. It has to be actionable information. Just useful information or information that may be needed later can wait with the digital record. So the nurse can resource that or source that information as they go back to the digital record. But always send information directly to the nurse that can be acted upon, actionable information. Another way to do that is to batch information and allow technology to do that for you if you have it, such as the electronic health record. Some other ways is to determine, can we use a mobile device that stays with the nurse so this actionable information goes directly to the nurse and they know that they have to respond to it. Keep the information in context. Stand-alone bits of information become very confusing in a chaotic environment. It always has to be in context of the patient, in context of urgency, in context of the workflow. Another core function in helping to carry the burden of memory is to allow technology to carry that information so the nurse doesn't have to store it in their memory, or put together processes or put together functions or protocols that can carry that burden of memory. As all of us know, interruptions are the enemy of memory, and nurses are interrupted thousands of times a day. Those interruptions, that forgetfulness will continue to add to the load that the nurse has, and over time, then that can either lead to errors that impact the patient and family, or it can lead to a complete burnout state for the clinician.